Hi guys, welcome back to my channel, and in today's video we're going to be covering everything about retinoids. If you're new here, my name is Dr. Anjana and I am expanding my career in cosmetic and aesthetic medicine. If you follow me on Instagram, you know that I'm not a really big fan of the term anti-aging, but when it comes to retinoids, I really want to put my belief into that term. Anyway, retinoids are like the base of skincare. And what's a retinoid? It is a vitamin A derivative, and there are various forms of it, which I am going to cover in this video. But mainly today, I'm going to be talking about how to get started with these ingredients and the basic FAQs that you do not see a lot of people talking about and not covering in general. So let's go. Retinoid is more of an umbrella term, and below these comes retinol, retinal or retinaldehyde, and retinoic acid, also known as retinoid. And these three terms that I just mentioned are first generation retinoids. Now there's the second generation, and third generations are adapalene and tazarotene. Any case, I will term this as retinoids for whatever products that you are using. Anyway, let's just jump to the FAQs. Question number 1. When should you actually start incorporating retinoids to your skincare routine? The answer is really simple. It really depends on what your concern is. I've had a lot of people DMing me on Instagram saying that they're too old for retinoids, or their skin is too bad, or they have a lot of active acne for retinoids, or their skin is too perfect for retinoids because they're scared that they're going to spoil their skin by purging, or somebody messaged me saying that they're too young because they're still in their teens and by using retinoids they might cause an effect called reverse aging. Hear me out. If you're a teenager with acne, scars, and hyperpigmentation, then teenage years is the right time to start. But if you're somebody like me who did not actually break out during their teenage years and just want to use retinoids as an anti-aging serum, then you might want to start it during your mid-20s. However, I started it when I was like 16 or 17 years old. So basically, it really depends on what your concern is. But mind you, if you're somebody in your mid-20s, late 20s, or early 30s, and if you've not started retinoids, you should start incorporating that in your skincare routine. You are young right now and your body heals really fast, so you might want to reap all the benefits of it right now. You don't want to miss out on the benefits of it by leaving this huge 10-year gap. But remember, a big note. You might want to avoid retinoids during pregnancy, lactation, and also when you have sensitive skin or rosacea. Question number 2. Somebody actually asked me, what ingredients can I use instead of retinoids during pregnancy, and why can I use retinoids during pregnancy? Let me answer the why first. You cannot use retinoids during pregnancy because there's a high chance that you will absorb the retinoids and it will directly affect the baby that's growing inside you. And what other ingredients that you can use? Well, you can use azelaic acid. Question number 3. What if I purge? Well, this is the most common question that I get on my Instagram. To be honest, I personally am purging right now. I have textures on my forehead. I have breakouts on my neck, my clavicle, my chest, everywhere, because I love to take the products on my face, neck, chest, and below. And I also like to apply it on my arms. So trust me, I am purging myself. There is a really popular saying that retinoids make your skin worse before it makes it better, and trust me, this is very true. Well, it's because retinoids increases skin cell turnover, and the breakouts or the pimples that you were supposed to get, I guess, 2 months, 3 months down the line, you're getting it right now in 2 weeks or 3 weeks because your skin cell turnover has increased 2x. You know why most people fail when it comes to retinoids? It's because when the skin starts going bad, they stop because they think that the product might not be working for their skin type, or it's just not working out for them in general and it's damaging their skin. Well, no, you gotta push through, and if your skin is actually going bad, then it means that your retinoid is actually working. After a while, you will notice that your retinoids are working just fine without irritating or purging your skin. For example, I would use over-the-counter retinoids for a very long time and it worked fine except for the dryness. I never had the purging until last year, and this year I actually started a higher dosage and I am purging. But I have promised myself to work through and not quit. Question number 4. How do I start with retinoids? Well, if your skin is on the combination and oilier side, then you can directly start with 0.5 over-the-counter retinols. But if you're on normal and dry side, then you might want to start with 0.25% of retinol serum. And you might also want to use the sandwich method, wherein you cleanse your face, tone your face, apply a moisturizer, then go with the retinoid, and then apply another layer of moisturizer until you get used to it. A typical bottle of retinol serum actually lasts for 3 months. So for the first month, you might want to use it every 3 days. For example, if you use on a Monday, give a 3-day break and then use it again. 3-day break again. For the second month, you might want to use it every other day, like with alternate days. And on the third month, you might want to use it every day. If it is prescribed by your doctor, then you might want to use something that is on 0.05%. And since it is medically controlled, it has lesser side effects. Here are some over-the-counter retinoids for beginners. First, we have the Survey, then we have the Granactive retinoids by Minimalist and the Ordinary. Then we also have 0.5% retinoids by the Ordinary. And then we have the 0.1% different gel. Now this is really good for somebody who has acne-prone skin. Before you buy any products, make sure that you're aware of this. Retinols are the least irritating, followed by retinaldehyde, then adapalene, then tretinoid, and the most irritating is tazarotene. I will write it down somewhere here for you. Question number 5, how to use it. Please use a pea-sized amount and make dots on your face and spread it all out. And make sure that you are protecting your eyes and your corners of the mouth, or like the mouth area in general, because if you irritate it, it might actually cause irreversible darkening. What I like to do is use a really low dose of retinol mixed with moisturizer to make my personal eye cream. And for the rest of the face, I use my potent retinoid. Question number 6, when can I see visible results? Like I said, people actually stop using retinoids when their skin starts to purge and starts going bad, thinking that the product is not suiting them or just not working out for them and that they need to give their skin a break. Well, that's not the case. The key here is to push through. If your skin is going bad, your product is working. So you gotta push through for at least 2 months, and that's when you will see visible results. In 2 months, you'll see visible results with your acne. In 3 to 6 months, you're gonna see really good anti-aging benefits. And in 3 months, you're gonna see your hyperpigmentation has slowed down. Question number 8, are retinoids safe for people of color? The answer is yes, yes, yes. But like any other products, you might wanna do a patch test before going all in with the product. Question number 8, and it is the last one. What are the side effects of retinoids? Well, it's dryness, irritation, photosensitivity, but then these are the factors that can be dealt with a proper thick moisturizers and a proper SPF. Other contraindications will be not using retinoids during pregnancy, lactation, or if you have rosacea. So guys, that's it for my video. If you have any questions, comment down below, and if you want to book an online consultation with me, just DM me on my Instagram. Bye!